Though X-ray chest is one of the most commonly ordered investigation in the OPD, it is the one that is most poorly interpreted by the beginners. In today's video, I am going to tell you 5 most common X-ray chest findings in the OPD that every young doctor should be able to interpret clinically and confidently. So friends, today's video is very important. You see this video till the end, and if you have come for the first time on this channel, then do subscribe this channel for more such clinical videos. So friends, without wasting much time, let's start the video. Now the first X-ray in our list is this. This is the X-ray chest of a patient who comes with the history of fever and cough, and on auscultation you will get crepitations on the right side. Now what are the findings here? Now if you see here, you will see that in the right lower zone there is a white patch like opacity, and in that opacity you will get many small black areas, and they are due to the air trapped in the bronchus or the bronchioles, and they are called as air bronchogram. And this is the X-ray chest of consolidation or pneumonia. Now the second X-ray in our list is this, and this is the X-ray chest of a patient who comes with dyspnea and pleuritic chest pain. Now the findings here are like this. You can see here on the right side the costophrenic angle is obliterated, while on the left side it is very sharp. And on the right side you will also see a meniscus sign, a concave shaped meniscus sign that differentiates between the air on the upper side and fluid on the lower side. And this is the typical X-ray of pleural effusion. This type of pleural effusion X-ray you can get in tuberculosis. You can also get this in malignant, also in pneumonia, and in congestive heart failure. In congestive heart failure, you will get bilateral pleural effusion. So this was our second X-ray of pleural effusion. Now the third X-ray in our list is this. Now there are 3 findings here. First, here the lung is hyperlucent. Second, you can see here the diaphragm has become flattened. Normally the diaphragms are dome shaped, but here the diaphragms are flattened. And third, the intercostal spaces, these are the intercostal spaces, they have become wide. And this is the X-ray chest of hyperinflation found in COPD, and it is very commonly seen in the smokers. Now this is our fourth X-ray, and this is the X-ray chest of a patient who comes with the history of weight loss, chronic cough and hemoptysis. Now what are the findings here? The findings here are that on the left side you will see opacity in the upper lobe, and in that opacity you will see fibrotic bands and also cavity like lesions. So this is the X-ray of Fibrocavitatory or TB lesions, and it is seen in pulmonary tuberculosis. Now the last X-ray in our list is this. Now in this X-ray there are 2 findings. First, the cardiac shadow is enlarged and the cardiothoracic ratio is more than 50%. Now what is cardiothoracic ratio? For that, first we take the maximum diameter of the heart shadow, we call it as A, and we also take maximum diameter of the thoracic cavity, we call it as B. Now what is cardiothoracic ratio? So if A upon B is more than 0.5, then we say that the cardiothoracic ratio is more than 50%. And this is the X-ray chest of cardiomegaly. This X-ray chest of cardiomegaly you can get in heart failure, cardiomyopathies, and certain congenital heart diseases. The important thing here is that the anteroposterior films, they can falsely show cardiomegaly, and hence to diagnose cardiomegaly you must have a PA film, that is posterior anterior X-ray chest film. So let's revise the 5 X-ray chests that we have seen today. First was of consolidation seen in pneumonia. Second was of pleural effusion, where there is a collection of fluid in the pleural spaces. Third was of hyperinflation seen in COPD. Fourth was of fibrocavitatory lesion seen in the tuberculosis. And the fifth was of cardiomegaly seen in the heart diseases. So friends, start seeing more and more X-ray chest films because this will improve your interpretation. If you could easily recognize these 5 common X-ray chest findings, it will tremendously improve your confidence in the OPD, in the ICU and in the ER. Friends, I hope that this video was useful to you. If you find this video helpful, give it a like, share with your friends, and if you have come for the first time on this channel, then do subscribe this channel for more such clinical videos. See you in the next video. Till then, thank you.